It is 11:41. Is Sacramento ready and available?
Yes, we are.
Awesome.
So at this time, we will do a roll call to establish quorum here in Sacramento and in San Diego. My name is Dolores Trujillo, and I am present. Board Member Jovita Dominguez,
Jovita Dominguez present.
Board Member Patricia Nguyen,
Tricia Nguyen present.
Board Member David Lawler,
David Lawler present.
Board Member Allison Cormack,
Allison Cormack present.
and in San Diego, Board Member Vicki Granowitz.
Vicki Granowitz present.
Thank you. Quorum has been established. Moving on to item 5.6. This is discussion and possible action regarding 2024 board and committee meeting times.
Thank you. And this one will actually require a motion and a second. And so for ease of our note takers, if you can please state your name before you make the motion and the second, that would be fantastic. And then we'll do a roll call vote so that we can get all members that are here, their opinions. So we do each year present 4 board meeting dates for you guys to consider to schedule and plan for the next year. And we schedule a board committee meeting the month prior to board meetings, except for just one oddity in there because we do have to meet every 3 months as required in our business professions code. But we do try to keep July meeting free. And so we do have an August board meeting. We meet in June for committee instead of July. So it is kind of back to back, but that is what is typically done to accommodate that. So on your material, starting on page 42, is a projected calendar with some dates. And if that is something that our board could agree on and that those work for you, we can get a motion to accept.
So before we do the motion to accept, one of the dates we will alter. Instead of May 22nd, 23rd, we're looking at May 23rd and 24th. Any questions or comment from the board members on this change? Any questions or comments from the board member in San Diego?
No questions.
Thank you. All right. I would like to make a motion to accept board and committee meeting dates for 2024 with the change in May. And that change is May 23rd and May 24th, 2024. Do I have a second?
Tricia Nguyen seconds.
Thank you. BRN moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. We will also poll the Sacramento and San Diego remote locations.
As you're opening it up, board moderator, I just want to let you know that our public members have exited the building and do not plan to come back until their agenda item is presented as part of the Education Licensing Committee materials.
Okay, thank you. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comment. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. There are no public requests for comments in San Diego. Are there any public requests for comments in Sacramento?
There are no public requests for comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, please. All right, we're going to take a vote. Dolores Trujillo votes yes. Board Member Jovita Dominguez,
Jovita Dominguez votes yes.
Board Member Tricia Nguyen,
Wynn, yes.
Board Member David Lawler,
David Lawler, yes.
Board Member Allison McCormick,
Cormac, yes.
and Board Member in San Diego, Vicky Granowitz.
Granowitz, yes.
Thank you. Motion is carried. Okay, moving on to item 6.0, BRN future priorities and proposals for review and possible action. 6.1, discussion and possible action.
Okay, so 6.1, discussion and possible action is a modification to a prior regulatory package that was put in front of our board to update Title 16, Section 1426 around the curriculum for our pre-licensure nursing programs. We do have the regulatory attorney from DCA available as well. I believe he is there in Sacramento. It was noticed on review that we didn't strike through enough of the language on 1426 that we were editing out. So on 1426 G2, there was the prior requirement that we do 75% of our clinical experience in direct patient care. And the sunset bill went through last year and codified that we now only have to require 500 hours in direct patient care. It is not broken down by 75% per each. And so in the prior language, we did not strike out the entire sentence. And what was left was in a board-approved clinical setting. And that is in the current statutory language and does not need to be restated. So I will open it up to the regulatory attorney, and you guys could find the meeting materials. It is just updating the strike through to include the entire sentence that was removed versus just a partial sentence.
Make sure was that the board in its motion had language to rescind prior proposed texts approved February 15th through 16th, 2023, and then approve the newly proposed regulatory text and the normal motion language. That's it. Thank you. Any other questions?
Oh, I was just going to note in the meeting materials, because I know there's a bunch of versions mentioned, it has all three. It has what is currently in regulatory text, what was voted on, and then what's being proposed. So you can kind of see where that difference is. It really is just a few words that was a drafting error. So for the sake of a complete rulemaking packages, we wanted to bring it back.
Thank you. We need a motion on this?
Correct. We need a
Yes.
motion and a second, and please
Okay.
state your names. And then just for, because we are in a virtual setting, Stephen Vaughn was the regulatory attorney that just spoke for us, and Marissa Clark that just provides some clarification is our chief of legislation.
Thank you. Any questions or comments from the board members? No? Any questions or comments from the board member located in San Diego?
No. This is Vicky Granowitz, no.
Thank you, Vicky. All right, so we're gonna make a motion to rescind prior proposed. Sorry, I can't read that far. Got it. Motion to rescind prior proposed text approved February 15th through 16th, 2023, and adopt the newly proposed regulatory text for section 1426. Direct staff to continue with the rulemaking file and proceed with review by the Director of the Department of Consumer Affairs and the Secretary of the Business, Consumer Services, and Housing Agency. Upon their approvals, authorize the executive officer to take all steps necessary to initiate the rulemaking process, make any non-substantive changes to the package, and set the matter for a hearing if requested. If no adverse comments are received during the 45-day comment period and no hearing is requested, authorize the executive officer to take all steps necessary to complete the rulemaking and adopt the proposed regulatory text as noticed.
Jovita seconds.
Thank you, Jovita. Can we open it up for public comment, please?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
As they are typing in, board moderator, I just want to let you know that we do not have any public members here in San Diego at this point, so we have no public comment.
Thank you. Board President Trujillo, there are no public requests for comments on the WebEx. Board EO Melby has stated there are no public requests for comments in San Diego. Are there any public requests for comments in Sacramento?
There are no requests for public comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, please. Okay, we'll take a vote. Dolores Trujillo votes yes. Board Member Jovita Dominguez,
Jovita Dominguez votes yes.
Board Member Patricia Nguyen,
Nguyen, yes.
Board Member David Lawler,
David Lawler, yes.
Board Member Allison Cormack,
Cormac, yes.
and in San Diego, Board Member Vicky Granowitz.
Granowitz, yes.
Thank you. Motion carries. At this time, before we move into the various committees, we will be breaking for lunch before we move into 7.0.
Board President, the committee update is relatively quick. San Diego location is asking if we could finish agenda item 7.0 and then go into lunch and then go into education licensing, if that is acceptable to others.
We can finish up 7.0 and then we'll break for lunch.
Thank you. Okay, so 7.0 is reported the Nurse Practice Committee. Board member, Vice President Mary Fagan is not here today, so Board President and I will tag team this and move us through this, this update. So agenda item 7.1 is information only. It is on our advisory committees. I will do a very quick update on each one of them. Letting you guys know that the Nurse Practitioner Advisory Committee and the Nurse Midwife Advisory Committee has not met in between last board meeting and this board meeting, so there are no updates. We have met with or scheduled meetings with the chair and vice chair of both of those committees to plan the agenda for the upcoming meeting, and we will continue to work to discuss items around both midwives and nurse practitioners going forward, as well as setting dates and stuff for next year. The Clinical Nurse Specialist Advisory Committee and the Certified Registered Nurse Anesthetist Advisory Committee have not been completely formed. We are still recruiting, or sorry, wrapped up recruiting the public member for these. We did have to re-recruit because the applications received for both of the advisory committees were not complete. And without complete applications, they do not move forward for review. So we did send out a list serve notification. We do have people that we believe are still interested in, but we are waiting complete application and following up the instructions in order to move those on to myself to review. And then once I get those, I will bring them forward to the admin committee for approval. And then we will appoint a public member to each one of these meetings, each one of these advisory committees. Sorry. We do plan that if we do get a public member soon, that we will hold our first meeting in the fall. We are in the fall, but so I am hoping that hopefully by prior to the end of the year. And the way that I know it's fall is because driving into this location, I heard they have pumpkin spice lattes out at Starbucks again. And I wanted to cry because I am not ready for that at all. So the final update is with the Nursing Education Workforce Advisory Committee. We did have a meeting. We did a stakeholders meeting in June. It was very well attended. They invited healthcare professionals, stakeholders, consumers, any interested members, and they brought up and discussed clinical placements, impaction, clinical displacements as well, to really kind of get an understanding around that. They talked about academic practice gaps, and they also talked about the nursing workforce, and included in that workforce is the nursing faculty for pre-licensure nursing programs and our advanced practice nursing programs, because they are required to hold an RN license as well. And so that was all brought up. We had robust discussions, a lot of education, cleared up what we hope to be a lot of misconceptions on jurisdiction and what BRN actually had the ability to address. And how to go about kind of working with that. They did set up some subcommittees who will begin working on those in between the meetings. And I did hear through the grapevine that the subcommittee that does simulation will be ready to present their recommendations at the next meeting. So I am anxious to hear what those might be. And if that does occur, that will answer the ask that came from the Sunset, where they formed the NEWAC committee and put it into statute so that it is required with the direction to give recommendation to our board on simulation guidelines and standards. So excited to move that through. At this point, if there are any questions from the board, I'm here to answer. If not, it is information only, so we could open it up to the public for comment.
Thank you, Lori.
You're welcome.
Mayor and moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give reminders as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board EO Melby, are there no public requests for comments in San Diego?
No public request for comments in San Diego.
Thank you. Board President Trujillo, there are no public requests for comments on the WebEx. Board EO Melby has stated there are no public requests for comments in San Diego. Are there any public requests for comments in Sacramento?
There are no public requests for comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, please.
Board President Trujillo, can we move to agenda item 7.3 and then reassess the time for lunch at that point? Just because 7.2 is long.
I'm sorry, Lori, I could barely hear you.
Okay. I was asking if we could reorder the agenda to move to 7.3 because 7.2 is a presentation and longer, and we can reassess time at that point to accommodate lunch. I know that your headquarter location there, they close at 1 o'clock.
Thank you. We will reorder the agenda to take on 7.3 before 7.2.
Thank you. So 7.3 is discussion and possible action in regards to the Nurse Midwife Advisory Committee. We did have a midwife who left the advisory committee, and we recruited. With that recruitment, we did receive 2 viable candidates. Of those 2 viable candidates, all the information was sent to the board committee that was set up a few years ago that would work on appointments for the Nurse Midwife Advisory Committee. It happens to be our admin committee members as well, with Board President Trujillo and Board Vice President Mary Fagan. As we know, Mary Fagan is not in attendance today, but I did receive notice from them via email that they had chosen Lilith Sarkissian. I'm so sorry if I butchered that name. She is a certified nurse midwife. She is nationally certified as a RN, certified in OB as well, and additionally prepared with a master's degree in nursing. Our chief of licensing has reached out to her and let her know that she was coming forward today to our board to be appointed. And we ask that our board consider this appointment, and if so, to make a motion to accept. And Dolores would be the one to answer questions for you guys if you had specific applicant request.
Board Member Allison Cormack.
Thank you, Chair Trujillo. Because I'm new, I don't understand very much of the processes. I'm learning them. When we have candidates like this, is it the practice of the subcommittee to do interviews or get references, or do you review the paper materials only?
For the most part, we review the paper material. This candidate had an especially strong application and background. We thought she would be a good fit for this committee.
Thank you for that.
Any other questions or comments from board members? Any questions or comments from board member in San Diego, Vicki Granowitz?
Granowitz, no.
Okay, thank you. VRN moderator, can you please take us to public comments?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
As they type in board moderator, we have no public comment in San Diego.
Thank you. Board President Trujillo, there are no public requests for comments on the WebEx. Board EO Melby has stated there are no public requests for comments in San Diego. Are there any public requests for comments in Sacramento?
No, there are no other requests for comments here in Sacramento.
Thank you. Would you like me to close this window?
Yes, please. So I would like to make a motion to accept this appointment of the new NMAC member. I hope I don't butcher this. Lilit Sarkisian to the Nurse Midwifery Advisory Committee. Do I have a second?
Win,
Cormac, second.
Thank you. We'll take it to a vote.
Just for clarification, I heard both Win and Cormac as a second. Do we need to clarify who is actually seconding?
Cormac.
Cormac. Board Member Allison Cormac.
Did we go to public comment earlier on this or? going to-
We did.
We went out of order. We did public
We
comment.
did, and I
Motion.
apologize for that.
That's okay, as long as it was opened up for this particular agenda item.
It was, yes. So we can do a roll call vote.
All right.
Dolores.
So we'll take it to a vote. Dolores Trujillo votes yes. Board Member Jovita Dominguez.
Jovita Dominguez votes yes.
Board Member Patricia Nguyen. Board Member David Lawler.
David Lawler, yes.
Board Member Allison Cormac.
Cormac, yes.
And Board Member in San Diego, Vicky Granowitz.
Granowitz, yes.
All right, the motion carries.
Thank you. Board President, I will ask, due to looking at the time frame up there and constraints of everybody, that we wait on 7.2 to complete after lunch.
Thank you. At this time, we will break for lunch. 45 minutes.
We can come back at 1 o'clock. That would be an even,
Perfect. 1 o'clock is fine.
sounds great.
Thank
Thank you. We will come back at 1 o'clock and we'll do 7.3 and then move into the Education Licensing Committee section of the board meeting. Thank you.
Thank you. Good afternoon. Hope everybody had a wonderful lunch and a break. We will take roll call to establish our quorum. Dolores Trujillo is present. Board Member Jovita Dominguez.
Jovita Dominguez present.
Board Member Patricia Nguyen.
Win, present.
Board Member David Lawler.
David Lawler, present.
Board Member Allison Cormac.
Cormac, present.
And Board Member in San Diego, Vicky Granowitz.
Granowitz, president.
Quorum has been established. Do we have Reza, our board counsel?
I'm here. This is Reza.
Thanks, Reza. Okay. Moving on to item 7.2. This is information only. Presentation of IV hydration. And I believe, Lori, you have this?
Yeah, I do. Sorry, I was trying to help Vicky troubleshoot. Her camera is not
No
working.
problem.
She is on camera, as you can see, as part of the room, and you could hear her. So we'll just go ahead and do the, should be a fairly quick presentation, and more just kind of open for discussion and comment from both board members and the public and public comment. IV hydration facilities are, the up and coming trend. We're seeing it very similar to the way that we used to see med spas, where they just kind of started popping up everywhere. And then really just taking a look at what is the impact for our board. I did have the pleasure of going to attending a meeting that was held with the National Council of State Boards of Nursing, as well as the Federation of State Medical Boards and the National Association Boards of Pharmacy. And then even the Federal Trade Commission had joined as well. So we were able to kind of really come together and see what is going on as a nation with IV hydration clinics and how those are coming in and affecting the practice of nursing. So I'm going to try to share my screen. I do have a really kind of brief PowerPoint that I will go ahead and share here that I just kind of put together. So let me know if you guys are able to see it here. Looks like it's popping up. Perfect. So with some of the discussion, we also had some discussion here with Department of Consumer Affairs, the Board of Pharmacy, the Board of Medicine, barbering and cosmetology as well, underneath the DCA boards, because we're finding out that this is affecting more than just us. So objectives here, just a brief overview of IV hydration, some of the current facilities and the names of the services that are offered, really a quick discussion about compounding. But what I really want to focus on and have conversation about is risk and public risk for this, and just kind of go through some of that. So for those of you guys that are not familiar, IV hydration is just IV fluids or intravenous fluids that are specifically formulated liquids that are injected into a vein to prevent or treat dehydration. They do have to be ordered through a provider that is typically a medical provider. As we are aware, in California and other states across the country, we do have advanced practice RNs that can order IV hydration as well. And so that would fall under your nurse practitioners, your nurse midwives, et cetera. We do that through the furnishing license that is here in California. Locations, where are these IV hydration clinics popping up? They're standalone retail and mobile facilities, med spas, holistic medicine and functional integrative naturopathic medicine providers, urgent cares that are not hospital affiliated, chiropractors, physiotherapists and wellness gyms, tanning salons, private practice facilities, and other medical centers. We're also seeing these pop up in dental offices. We're seeing them pop up at shopping centers and malls across every location as well. Here you can see a depiction of where IV hydration clinics are saturated. You can see that California is the most. And so we have the highest amount of IV hydration businesses in California than any other state. You can also see that they are growing in Texas and Florida, but we hold the bulk of it. And so it's very important for us to kind of take a look at this and see how this affects regulators and how this affects the risk to our public. Examples of the names that you'll see are Asthma Help, Immunity Boosters, COVID Rescue, Hangover Fix, Antioxidant Therapy. They have a lot of things here that people are marketing out as quick fixes to really just kind of give you more energy and really help you with brain fog. There's a bunch of things. So you will see these. This was just found on a quick internet search of some of the names, and this is not an inclusive sample. There's so many more out there. So what does this mean for us? What do we look at for oversight? We have Business Professions Code 2725, which is our nursing scope of practice. As a nurse, you are allowed to administer any medication through any route as long as you're competent. Give me 1 second. It looks like our screen is kind of going black over here. So, real quick second. Can you just touch that where it says touch to cancel? So are they still considered public members if I ask them to work? So sorry about that. So we're back up and going here. So with that IV hydration oversight, it is within the nurse's scope of practice to administer these medications. It is within the scope of practice for our advanced practice RNs with furnishing license to order these medications. So it's not like we're just going to kind of start hitting every IV hydration clinic and start doing investigations, because they are within the scope of practice of an RN. But what we are doing is looking at this as a complaint-driven process. That is effective at this moment, but really what I'm asking is for us to look at it from a proactive approach and not just wait until we start to get complaints. Some of the complaints that we are hearing at a national level is that the compounding practices are not being followed. That is something that is prohibited in California, is that RNs cannot compound. It is in our business professions code, again, that RNs cannot compound. That does not address the call out that is allowed for immediate use preparations that fall within the guidelines of pharmacy for immediate risk of death or injury. And so I don't know how an outpatient IV hydration clinic would ever fall underneath that. And if they're doing this as an IV hydration clinic, I would hope that they're not at risk for immediate death or injury if they're not giving this medication. So the complaints that we've heard nationally are sepsis, multi-organ failure, problems with the pharmaceutical company not using sterile packaging and processing and sending it in, that the facilities where they did compact may not have been appropriate. Not a lot of complaints on the nurse level themselves that has really come across yet, again, because IV administration is a very common task that an RN will perform. And it usually is very limited on any kind of risk that comes with that. The one thing that we really do need to take into consideration is oversight. It is an involvement of multiple disciplines. And so that becomes very complex because we do have to work with the medical board because, as you all know, that our advanced practice RNs are required to work with a physician, not necessarily under a physician. Some of our advanced practices are, but then we are also, if you're not an advanced practice RN, you are an RN that is out there administering this, you must work under a provider's orders. Currently, the nurse practitioner and the nurse midwife are able to order the RN through the kind of designation of that overseeing physician, because in our business profession code, an RN is supposed to work underneath a podiatrist, a dentist, a psychologist, and a medical, a physician and surgeon. Our business professions code has not been updated to include the advanced practice RN. And so that is done through nurse delegation, not necessarily something more extensive than that. Additionally, our 103 NPs are only allowed to serve in those roles under certain group settings. And one of those that is not included in those group settings is a nursing corporation. They have to work under a medical corporation, and the medical corporation is a 51% owned physician, and not vice versa. And so those are things that we're really seeing that people are not following as they're doing their nurse entrepreneurship and opening up businesses, is they're not completely aware of the Moscone-Knox Act. They're not completely aware of what is able to be done under our business professions code. And I don't think that they're attempting to do that on purpose. I think it's just a lack of knowledge. And so again, one of the reasons why we're having this discussed at our board meeting. So with that, the FDA did list a risk alert that they put out in 2021. I'll just read it off the slide here just so that it has some audio for it, but you guys can all read as well. They highlighted concerns and says the FDA has become increasingly aware of drug products compounded at medical offices and clinics that were prepared under insanitary conditions. FDA has also become aware of business models such as intravenous or IV hydration clinics, medical spas, mobile IV infusion services that are compounding drugs that may not meet the conditions under 503A of the FD&C Act or comply with state regulations. And again, compounding medications is something that needs to be done in a compounding pharmacy, typically under sterile and cleaned conditions, underneath hoods with special equipment. Again, there is a call out that allows for immediate use if we do meet certain criteria on that. But even with that, it is not admixing more than 3 sterile medications at any time. And the base IV solution is considered 1 sterile medication. So by adding just 2 additional things in there, you have met the limits of what a nurse can do for compounding. Again, those are typically in operating room situations and such where it is threat of immediate loss of life, et cetera, to meet those criteria. It is not typically part of an outpatient setting like these are. So if an RN is mixing anything into these IVs, they are not in accordance with their scope of practice, and they are absolutely violating their scope of practice at that point because, again, RNs cannot compound. So the next thing is just to really kind of discuss risk. Infection or sepsis, that's the one that we're hearing the most of. Sometimes when the pharmacy delivers a batch, that batch is bad, and you'll get multiple people that had this infused coming into various healthcare institutions in that area, letting them know that they are not feeling well and they have an infection, and then they can trace it back to a certain location that had this type of medication IV delivery, and then follow those lot numbers back and find out where it came from. And there are a few pharmacies out there that are really kind of being looked into for some not good practices. Medication interactions. There are some times where people will go in, they don't take a complete history and physical. They're not seen by the provider prior to administering these IV solutions, because they walk in and they sit down and they choose from a menu essentially and say, I would like this cocktail essentially. And then that is what is administered. The financial cost, it's $100 to $300 a lot of times per IV solution that they will administer, and it is not covered by insurance. And so there is a financial risk for the people that participate in this. And then misinformation. That's a big thing. You know, they say that it clears brain fog and that it can help with weight loss, and they're quoting studies that are not scientifically backed, that are not peer reviewed, that are not confirmed by the FDA. And additional organization that has joined this project is actually the FTC. So the Federal Trade Commission has come in and taken a look at this, and they're looking at it from that misinformation side. And so with the FTC Act, it outlaws unfair or deceptive acts or practices. So they are not necessarily involved with any regulation, the practice of medicine, or any individuals. But if you're saying that, hey, this works for this, and this is going to cause you to, you know, drop dramatic amounts of weight, and it's going to do all these wonderful things for you, if they put that into the traditional media, print, radio, television, online ads, website, social media, email, product labeling, point of sale displays, etc., then that is covered under the Federal Trade Commission, and they can investigate that. And so with that, that's pretty much where I'm at. In this quick little discussion, just to let you know that California is looking at this. We are involved in this on a national level, and we're looking at how to facilitate this through regulatory oversight to ensure that it stays safe, that these practices are consistent with the Nursing Practice Act, and that this doesn't get out of control. But I'm sure that you already seen by the map that it is absolutely very prevalent in California. And so we do need to have some information out there and some discussion around this. So I will stop my presentation and open it up for questions.
Thank you, Lori. That was really interesting, but it's also sobering. Board Member Tricia Nguyen.
Thanks very much, Lori. I've never even heard of this before. So When you say we get complaints, are they, we haven't seen anything coming through the discipline cases yet that I'm aware of. What are the complaints based on, and what are our possible causes of action?
The complaints that I've seen to date are sepsis. And that's really the biggest thing that I've been witness to is we actually had a nurse submit a complaint that she believes that some patients that she treated became septic after she administered the IV hydration to them. So again, not a problem against the nurse or the nurse's license or that the nurse was doing anything wrong. She was worried about either the equipment that was used to administer it or the IV solutions that were provided to them that may not have been done in the appropriate manner.
Thank you. Any other questions or comments? Board Member Allison Cormack?
Thank you, Chair Trujillo. Ms. Melby, on the slide with all of the states and things, I couldn't quite tell what the key was. Is that like the number of, is California Black because we have the most, or is
Yes.
it like the most per people?
We have the most.
Okay. But we also
Yeah.
have the most people in the country, right, too?
Kind of, we run hand in hand with some other states where we do, but then also when you look at how many nurses, we do have over 500,000 nurses in California, with the two other states that run closely behind us on the number of nurses, following in with Texas and New York. So we do have a lot, but not a tremendous amount when you're looking at the saturation of it.
Okay, thank you.
I have a question, Lori.
Absolutely.
So who has oversight? Does CDPH have oversight, or who authorizes them to or license them? I'm sure
Oh,
there's a license
goodness. So,
involved.
yeah, that's kind of a loaded question there because there's many, many people involved. And that was kind of the issue that we kind of came across with this is you have the med board. The med board is going to be overseeing the medical practice of this. The nursing board is going to be overseeing the nursing practice of this. The pharmacy board is going to oversee any of the medication components, the compounding, any of the compounding pharmacies that may have been involved in this as well. But then if you're having a mobile clinic, you actually have the DMV that gets involved. You have CDPH that gets involved because it's a licensed healthcare facility and it has to be licensed appropriately so that it can so that they can deliver that through a mobile resource. It is common for nurses to participate in home health activities, palliative care, hospice care in a home health setting. Even, preterm labor and stuff can be treated in a home health setting, and we've taken care of newborns in a home health setting. And so nurses practicing in home is not something that is new. Kaiser even has a hospital at home program that they're piloting. And again, so that's not the aspect that is typically brought up for discussion, but it is looking at, is the facility properly licensed? Is the facility licensed in a manner that they can provide these mobile services? Who are they tied to? Is there the initial history and physical exam done by a provider and not just an RN assuming care as soon as they walk in, et cetera? And one of the bigger things with pharmacy is a compounding pharmacy must make a patient-specific medication, including IVs. And so to look at this logistically is there would have to be a exam. There would then have to be an order for that type of IV fluid. And then they would have to have that compounding pharmacy make it specific to that patient and then have it delivered to that facility. Then it could only be administered to that one patient. If that patient is a no-show, that's a couple $100 solution right there. That what we're hearing are people just popping on a different label with another patient's name on it and then giving it to that next patient. And that is not the intended use for compounding medications that are supposed to be patient specific. And so that's some of the things that we would look at if we went out and did an investigation, is to look at the labeling of the IV solution bag, look at it if it is designated to a patient, what the compounding pharmacy is, what the ingredients are within that solution, et cetera. And that would be all managed underneath the pharmacy board. So there's so many people involved in this that we're really going to have to come together to work with everybody.
Thank you, Lori. Any other questions or comments from the board members? All right, BRN moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as the time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Gerard Brogan would like to make a comment. 1 second, please.
Thank you. This is a very concerning initiative that's going on, and I know it's going on here and in other states. I'm more concerned about the false claims about the health benefits of this. Surely that would come under gross unprofessional conduct under the Nursing Practice Act. Given, and again, I've looked at this probably like a lot of you, frankly, I don't think it's a good idea, period. But I'm just curious about the board's attitude to that. I know it's now complaint driven, and I'm not sure, and forgive me, how the BRN investigators work, but you're seeing all this hype out there. Could an investigation be triggered by certain false claims? And that's my question. Thank you.
Yeah, I'll be happy to address that. If it is false claims made by the nurse, then it would fall under our jurisdiction to look to see if that'd be something that would be gross negligence or unprofessional conduct, something to that effect. A lot of times it's not the nurse making those claims, it's the company that they're working for. And those claims would have to be turned into, like the Federal Trade Commission stuff so that they can evaluate those and FDA. But if the nurse is the one that's making the false claims, then that would fall under our jurisdiction.
Thank you for your comment. Board President Trujillo, there are no public requests for comment on the WebEx. Board EO Melby, are there any public requests for comments in San Diego?
No comments for public requests for comments in San Diego. Thank you.
Thank you. Board President Trujillo, are there any public requests for comments in Sacramento?
No public requests for comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, thank you. As this was information only, we don't need to take further action at this time. Thank you, Lori. That was a wonderful but sobering report.
Thank you.
All right, we'll move on to item 8.0. This is the report of the Education and Licensing Committee, ELC. Jovita.
Good afternoon. My name is Jovita Dominguez, and I'm the chair for the Education and Licensing. For 8.1, discussion and possible action regarding ELC recommendations or consent agendas, I believe Dr. Marianne is on to help us. I see her on the WebEx.
Hi, good afternoon.
Good
Good to see
afternoon.
you guys. I am Mary Ann McCarthy. I am a supervising nursing education consultant and the liaison to the Education and Licensing Committee. And thank you, Jovita. Yes, I will begin. Before we start on the agenda, though, I do want to bring to everyone's attention that in the packet, on page 18, this is not a new packet, but there was one additional item added to this particular to this meeting, and that is under progress reports, and it is Loma Linda University. Their nurse practitioner program has submitted all the information and documents needed for our NEC team to move them forward in adding a neonatal nurse practitioner track this fall. So it's on the list under, again, progress reports. It's down toward the bottom under advanced practice, APRN section. And that's the only change in the consent agenda items. The others, 8.1.1 all the way through 8.4, all of those agenda items were presented at ELC, Education and Licensing Committee meeting. And all of them had a unanimous recommendation to approve or accept what was presented or asked for at that meeting. So moving forward, as far as 8.1 and all the discussion about the possible action regarding ELC's recommendations on consent agenda items, we can take these items all together, 8.1.1 through 8.4, if you'd like, and vote on them together. Or if there's anything in particular that you want to pull out for any reason, we could do that as well.
So Reza, really quick, as a point of clarification, if they were to make a motion to accept the recommendations from the Education Licensing Committee, how would they include the updated information that was added to the progress report on Loma Linda? Would that be a separate motion to accept that progress report from Loma Linda as a consent agenda?
It might be a little just cleaner and simpler to pull that one out, given
Okay.
that it's got some special
Perfect.
stuff
Thank
going
you.
on.
So we could do that. We could take 8.1.1 to 8.4, taking out the progress report list, and vote on, if you want to accept or not accept the recommendations of the Education Licensing Committee.
This is Vicky in San Diego, and I have a question.
Sure.
I don't want to take anything out from consent, but I wanted to make an observation, a general observation. Can I do that before or after or
at any point?
Yes,
At any
Vicky, go
point?
ahead.
It's fine.
Oh, okay. And again, I'm not interested in pulling anything, but if you go to page 10 and 11, you'll see that there are a number of, in the summaries where there are reduction in clinical placements where different schools usurped other placements and cancellations of placements. And so I just think that while there may not be anything that we can do about it now, that it's going to be a continuing problem. And in the pages afterwards, there's also similar kinds of issues with getting staffing in these programs that is also going to be a continuing problem. So I don't know what to do about it, but I just was really alarmed when I was reading all of this. And I just want to make sure that we acknowledge that we are heading into dark waters, I think. But end of comment.
Yeah, thank you, Vicky. And I'll provide just some clarification. In, I believe, 2 or 3 meetings ago, I worked with the nursing education consultants and we kind of rearranged some of the progress reports. And we made 2 new sections of the progress reports. One of them was clinical concerns reported from the programs. And then the other section was faculty concerns reported from the programs. We wanted to make sure that the pre-licensure nursing programs had a ability to report those to the NEC, and that they would then move from the NEC to the board members. It was noted in the past that a lot of times as the NEC was working diligently with the programs to work through those faculty issues, to work through those clinical issues, that it was handled and rectified at that level. And then we talked about it in board meetings as kind of generalized issues that the NECs are working with schools to get facilities, that facilities have been lost, that faculty, there is a turnover, that there are not enough faculty, but nothing that allowed for you guys to really grasp the that what's really going on out there. So it was decided that the NECs, when they get the information from programs that there are faculty issues, that there are clinical issues, and that is affecting the running of the programs with progression and graduation, et cetera, that we would bring it forward as a progress report so that the board members are aware of what's going on out there. We don't have any jurisdiction over, addressing faculty issues. I mean, we do approve faculty, but we cannot get into conversations about faculty pay, et cetera, like that. Working conditions and stuff. Those were kind of stuff that we talked about as part of the NEWAC committee report out, and some of the stuff that we talked about earlier that came out in public comment, and then with Brendan's report. So it is there. It is just more information for our board to be aware of. Thank you for pointing that out, Vicki.
I have a question for Reza. Since we just received the amendment on Loma Linda that was reported very clearly, would it be a clean enough motion at this point to accept them all, 8.1 through 8.4, and simply add as amended for Loma Linda? Is that good enough?
I think that's fine as long as board members don't have any, questions or want to pull that out separately for discussion or motion. As long as everybody's clear about what's taking place and had a chance to review the material and understand it without the need for a separate discussion about it.
Thank you.
Okay,
So David, was that your motion?
sure.
Through the chair, yes, that's my motion to accept recommendations 8.1 through 8.4 as amended for Loma Linda.
And I second it. This is Dolores Trujillo, board member. All right, we have a motion on the floor. Let's open it up for public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment.
Board moderator, as you pause, I want to let you know that there's no public comment in San Diego.
Thank you. Is it Committee Chair Dominguez or is it Board President Trujillo who's running this committee?
So it is a board meeting, so it'd be.
Member Jovita Dominguez.
Perfect. Thank you.
Okay.
Thank you. Sorry.
We're in conflict. That's totally okay. I will let you take the lead on that, Dolores. If you want to delegate that out to Jovita, go for it.
It's okay, Lori, what were you going to say?
It's a board meeting, and so typically the board president manages the board meeting in total when it comes to these kind of questions. But you can definitely delegate that out to Jovita.
Both of us.
Got it. Thank you. Okay, Board Member Dominguez, there are no public requests for comments on the WebEx. Board EO Melby has stated there are no public requests for comments in San Diego. Are there any public requests for comments in Sacramento?
There are no public requests for comment here in Sacramento.
Thank you, Board President Trujillo. Would you like me to close this window?
Yes, thank you.
Okay, real quick, we just did have another public member enter the room, is asked to make public comment. Is it too late?
No, that's fine.
This is Michael Jackson, former board member and board president of the Board of Nursing. Just want to welcome the board to UCSD. Thank them for having here. I have a student here from Maricosta College. She is excited to learn about what the board does. We're just stopping by to say hi.
Thank you. There are no
Jovita,
further public comments. Thank you in San Diego.
We have one more request for comment, Board Member Allison Cormack.
Thank you. I'm just not quite sure when we're supposed to ask questions, if it's before the motion is made or after public comment.
Ideally, it would be before.
Before the motion. Okay, great. Thank you. I'm just trying to
Allison,
understand.
sorry, this is Reza. Also, just to be clear, you can generally board discussion takes place, kind of the usual flow of an agenda item. It's board discussion and then a motion and then public comment and then a vote. But sometimes it goes a little differently and you might take public comment sooner or, but really at any time, if a board member has a question or wants to add further thoughts, please feel free.
Okay, that's helpful. Prior experience, we've listened to public comment before motion, so I just have to reorient myself. I just want to be sure I understand 8.2.4 because this whole structure is new and obviously written by people who understand all the details. So if I read the summary of 8.2.4, I get concerned about enormous numbers of attrition recently. But they're asking to add enrollment, but is this also the one that is not taking nurses for the next session? It's just a little bit hard for me to follow this one. Maybe I've missed something. Maybe I have my things in the wrong order.
no, you're right. 8.2.4, I believe you're looking at is Merritt College Associate Degree Nursing Program. And this section is discussion and possible action regarding board approval of ELC's recommendation to defer action status on these approved nursing programs, asking them for quarterly progress reports to be submitted to their NEC and returned to the board in a year. So these programs are all on deferred status because they are not in compliance with all board rules and regulations. And so they don't lose their approval. It's just the action of the board is deferred, giving them time to come into compliance. So yes, all of these, including 8.2.4, are in non-compliance. 8.2.4 in particular doesn't have enough faculty, doesn't have enough resources. They did pause their enrollment voluntarily this fall in order to, because they only have 4 full-time faculty members, in order for them to not only have enough people to teach, but also to have faculty available to be able to go through their curriculum and update and improve their curriculum. Does that help?
Yes. And we're
So-
going all the way through 8.4 on this motion. Yes?
Yes,
Yes.
Let
that's
me just
correct.
check 8.4, make sure.
And then.
And you'll see that we
Wait.
put the votes on here for each of them.
And that's
so
very
that-
helpful.
Yeah, so
and,
that we
you
know that it's either unanimous or not.
Okay.
um,
All right.
And
And
so
with-
it was through those all the way through up to, and so the next two will be 8.5, unless of course you have any questions, and we're happy to.
So
talk about
8.4
those.
is just on which page? Because I printed this out before I came, so I've got other ones here. Sorry, what?
That's okay.
86. Okay, great. Let me just give me a moment here just to make sure I've followed all this along.
And then just as a point of clarification, you had mentioned that these were enrollment increase requests. And I just want to make sure that we're aware that 8.0 is not inclusive of just enrollment increase request. 8.0 covers many different items that were put forward. 8.1 talks about accepting clinical approvals. 8.2 talks about the continuing approval of pre-licensure nursing programs and other changes. And so if the nursing education consultant has done a review, either independently or in collaboration with a national accrediting organization, and they found them to be in complete compliance with all boards rules and regulations, they go through as a consent agenda item to just continue their approved status. If there's anything that they are not in compliance with, that is where they typically maintain an approved status, but the board makes a motion to defer taking any action. And that then they give them an actual action item, which is to give quarterly progress reports to their NEC, have those reported back to our board at the quarterly meetings. They may tell them to come back in front of the board in 1 year or 2 years to reevaluate their progress towards coming into compliance with all of the areas that we oversee. And so they defer action on the approval status, but they do make an action on what they want that school to do for continued monitoring during that time frame. Additionally, if there are curricular changes, if they resequence courses, if they change names, if they add courses, if they do anything with that, that'll be under this section as well. So it is not just enrollment concerns or enrollment increases that come in this section. And so that might have been some of the confusion that you were falling under 8.4, where you saw, or sorry, 2.4, where you saw that these schools looked like they had metrics that were showing that they were struggling, and that you were concerned on whether or not they would have more students going into a program that was now at risk. And so just wanted to clarify that because that school is struggling, that it was addressed for an approval status, not an enrollment increase request.
Okay, that's very helpful. And then now that I've finally found 8.4, so I'm on page 90 and again, this is all just for my information to get more familiar with how the committee and the board makes its decisions. Is how would a member of the public or myself get information on the requests that were recently denied?
Which agenda item is that again? I'm sorry.
So I'm on
8.4?
8.4 and I'm on page 90 in that section.
So 8.4 was not denied. This was discussion and possible action regarding ELC's recommendation for a new feasibility study.
Right,
At
but
High
it
Desert?
references on page 90 that 2 requests for Region 8 were recently
Mm-hmm.
denied.
Yes, thank you. So that happened at the February board meeting
Okay.
this year.
All right,
And
so,
in the February board meeting, you can go back and get minutes from there, or you can watch the
Okay.
WebEx, or if you needed to, we can bring it out and have further discussion.
very helpful. And then I'll just say here that it's, the table is helpful in terms of data, especially the numbers. I think though, it only, for me to make better sense of a table like this, and they'll be coming up later, I would have 2 thoughts about how we could get better information. One would be to have the base. I don't know what the base number is. I just see the deltas here. And the second is if it could be seen on a map as opposed to just listed here. I mean, I could go through, I guess, and map them all out myself. I'm not trying to ask staff to do more work without, balancing the information that would be helpful. So
So
yeah.
just real quick, you're not asking for additional work. That is a project that is in process.
Okay.
Where all the nursing programs will be mapped out and their locations throughout the state. It will show current enrollment at each one, and we will show growth or recession on an annual basis. I do want to screen share really quick just to show where some helpful information may be located. Just give me 1 second here to pull it up. And so when you do look at our website at rn.ca.gov, if you go down to the section here, I'm going to scroll here to the BRN School Survey and Interactive Dashboard.
Laura,
can
Lori, we
click on
can't see
this.
anything, just so you
No,
know.
it's not. It's not showing. Okay,
That's all right.
let's
I'm
see.
following BRN School
okay.
Survey.
There you go.
BRN School Survey. So I'll back up. So we're on rn.ca.gov. Scroll down here to the BRN Survey Interactive Dashboard. And
Okay.
this here does show data from 2012 to 2020,
Okay.
program level data, regional locations, LA area, et cetera. And then you can click through and you could find school list. You could find number of programs, enrollment by region. So there is a plethora of information on our website that you can, in preparation for a board
Okay.
meeting, go ahead and look at.
Thank you.
But we are also looking to incorporate an interactive map that is just enrollment and school location and data. And that will come, I promise, and it will carry the information that you're looking for
Okay.
on base to see what is our current student. I can tell you just from a global level, we do about 30,000 RN students at any point in California at this location. It is about 50-50, almost right down the middle, where 50% go to a private institution and 50% go to a public institution. The public institutions are shared between the CSUs and our community colleges, and the private institutions are both not-for-profit and for-profit. And it's about a 50-50 split.
Thanks for taking the time to do that. And I just check with Board Member Dominguez that you consider this level of information when the committee looks at these.
Yes, I do. And Dr. Marianne McCarthy helps me understand because the first year was really hard.
Okay, thank you so much.
So we do have a motion and a second. Is that correct?
Yes.
Thank you.
Any other comments or questions from the board? All right. Any comments or questions from the board member in San Diego? Vicki Granowitz?
Granowitz, no.
All right. And we've opened up for public comments, so we will take this to a vote. Dolores Trujillo votes yes. Board member Jovita Dominguez?
Jovita Dominguez votes yes.
Board member Patricia Nguyen?
Win, yes.
Board member David Lawler?
David Lawler, yes.
Board member Allison Cormack?
Cormac, yes.
And board member Vicki Granowitz?
Granowitz, yes.
All right, thank you.
Thank you so much. We're going to move on to agenda item 8.5. Discussion and possible action regarding Education and Licensing Committee recommendation to defer action to the board on the feasibility study for a new pre-licensure nursing program, United Nursing College Associate Degree Nursing Program. So information on this program is starting in your packet on page 99. And board moderator, if you could please elevate the presenters in case they're needed for United Nursing. So United Nursing College presented at the Educational Licensing Committee in June of 2023. And the Education Licensing Committee deferred to the board for the decision, and also asked for the program, United Nursing, to get some more facility approvals in the acute care setting, that they be obtained and they be submitted to their NEC. Since the June meeting, the program has done that. This is a newly established program. It'll be their first program, and the program is located in Marietta, which is in southwestern Riverside County. They have submitted the documents requested and they have been reviewed. The enrollment request is for 40 generic students and 5 LVN to RN students twice a year, for a total of 90 students annually. I added the not only the agenda item summary, but we still have the data in there for Region 7, which is where they'll be considered. And the representatives from the school are here to help answer any questions.
And then just to interject quickly, in the Education Licensing Committee, this was discussed at length. The ask that came forward was that they show that they had a clinical affiliation with at least one acute care hospital, because that is part of our business professions code for approving a nursing program. And then just for further knowledge for our stakeholders and our new board member, a feasibility study is a brand new nursing program. Once they make it past this section, they pretty much have the go ahead to invest their time and money, hire in a nursing program, secure a location, hire on faculty, create curriculum. And then they have one final step that they'll go through prior to getting that ability to enroll students. And that is where they will work with their nursing education consultant. They'll complete a self-study. It's a self-assessment on showing how they believe they've met all the rules and regulations of our board. And then the NEC goes out to that location, verifies everything, assures that they have met the rules and regulations. They bring it in front of the board, and then the board allows them to start enrolling students at that facility. So it was updated that this program did get an acute care hospital affiliation signed agreement, and it looks like they are in compliance with all of the requirements for acceptance of the feasibility study.
Thank you, Lori. Any questions or comments from the board members? No? Okay. Allison, board member Allison McCormack.
Thank you, Chair Trujillo, now that I know when I'm supposed to ask questions. What is a modified concept-based curriculum?
That is, so in our curriculum, we have a California Code of Regulations 1426. In 1426, we talk about needing to cover several specific courses and content. Of that, we talk about specific nursing content. There's 5 areas: med-surg, OB, peds, psych, mental health, and GERI. Traditionally, they will break those courses out to individual subjects. And so you'll see fundamentals of nursing, med-surg 1, med-surg 2, med-surg 3, OB as a separate course, pediatrics as a separate course, etc. When you're looking at a concept-based curriculum, whether it's a modified or full concept-based, they combined those nursing areas. And they will teach med-surg with geriatrics. They will teach OB with med-surg, pediatrics with OB and med-surg, etc. And they talk, instead of talking about the different care areas, they talk about the respiratory system and how it affects, from birth to end of life. They'll talk about various items that encompass a person holistically throughout any part of their healthcare continuum, versus siloing them out into individual sections.
That was a great answer. Thank you so much for the non-medicine people. Appreciate that. And I just I just want to say I was very happy to see, and I don't know that it's always provided the support services listed, including all the way, referrals for housing and including food pantry. It's disheartening that that has to be something that's provided at our secondary education facilities, but I was glad to see that that's been thought of.
Yes, thank you. That's expected when we look at programs. We expect them to provide services for their students. Thank you.
Any other questions or comments from the board members? All right. I appreciate United Nursing College for your efforts. I appreciate your efforts to go through and obtain a acute care hospital. Really, you've completed all we've asked you to do. So I'm ready to make a motion to approve the feasibility study to a new pre-licensure nursing program, United Nursing College Associate Degree in Nursing Program.
David Lawler, I second.
And I just want to add that we're accepting their enrollment request for 40 generic and
Yes.
5 LVN to LVN students twice a year, with an enrollment and pattern of 90 students annually.
Thank you.
You're welcome.
Bureau moderator, can you please open it up for public comment?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Angie Camacho would like to make a comment. 1 second, please. Go ahead. Ms. Camacho, we cannot hear you if you're speaking.
Are there any other public comments that can be taken while you're troubleshooting this one?
She's unmuted. She just can't speak, I'm assuming.
Okay,
She says she's going to type in her comment. She has audio issues.
Okay.
Okay, there are, let's see, are there any, there's no WebEx comments other than Angie Camacho's. Are there any public requests for comments in San Diego?
No public request for comments in San Diego.
Thank you. Karen McDaniel, would you like to make a comment? I will unmute you. 1 second, please.
Consider trying to get in to make a comment. Dr. Schultzel, Dr. Hung, John Lavelle.
Those are, Dr. Hong is the president and CEO. He's a panelist. Who is the other one? In the panelists are Dr. Hong. Yeah, Dr. Hong is on the panel. Dr. Hong, are you able to unmute?
Yes, can you hear me?
Yes.
Okay, great. Now I'll be brief. First of all, I want to thank you all for just, really taking our school into this really, thoughtful consideration. I mean, it's really been a passion of very much a journey of passion and love and commitment amongst everyone who's been involved with this process from day one. Really, from our standpoint, like, the community, I think, would be in tremendous benefit from having this school. I think it would help supply the needs of not just the hospitals in the area, but all of our medical practices and so forth. I represent a private practice called United Medical Doctors, where we started out with just myself and one other guy like 20 some odd years ago. And over that last 20 years, we have evolved that practice, an independent private practice, into a group of nearly 200 providers, 35 clinical sites, 9 ambulatory surgery centers, various ancillary service lines representing over 35 medical and surgical subspecialties, representing independence, freedom, and the ability for patients to make choices and so forth. We very much value all the relationships we have with the community hospitals and our community as a whole. And from the perspective of education, we really believe that we have been blessed with this amazing group of nurse educators within United Nursing College, who all carry that tremendous amount of passion for patient care and for educating the next generation of amazing nurses and careers and so forth. So we very much appreciate your support, and we certainly hope and pray that you will continue to support us in our journey here. So thank you very much.
Thank you. Mark would like to make a comment. He is on a cell phone. Mark, if you are, I will give you the request to unmute. I believe it is *6.
And then as you manage that, board moderator, it does look like Angie Camacho did type in there, just mentioning that they're the CNO of Temecula Valley Hospital. They would like to thank the board for their support as we partner with United Nursing by providing them clinical placement for their students. So these look like all comments in support of the board's motion. Thank you.
Mark, your phone is *6, I believe. Okay, Mark must not be able to unmute. San Diego, was there any comments in San Diego?
There are no comments in San Diego. Thank you.
Thank you. Board President Trujillo, are there any public requests for comments in Sacramento?
There was a hand up on the screen. Julia Robinson.
Hi, if I may, I'm the Dean of United Nursing College, and when we originally submitted our feasibility study, it was for the 90 students, but when we updated the feasibility study, we did increase it to 120 because we have the clinical sites and the faculty to support that. So we would like for you to consider 120 students annually.
This is for United Nursing College.
Yes.
So with United Nursing College, just so you're aware, board president, in the meeting 2 months ago, when we were at the Education Licensing Committee meeting, what was put forth was 40 generic and 5 LVN to RN students enrolled twice a year, 90 students annually. When it was brought forward again from Education Licensing to the board, it was brought forward with the request for 90. It was not brought forward asking for an additional request. If the NEC is available, it might benefit to ask if on their review of the feasibility, they considered the larger enrollment number. Because as what's important for our board members to understand is these feasibility requests take about 6 months. In that 6 months, our NEC works with that program to go over impact to community, budget, resources. I mean, it's a long 6-month arduous process to get through this. To have a change come through at a last moment, I can't guarantee that our nursing education consultants have been able to utilize to get that information and go back and re-review additionally. So what may be the recommendation, since this is a new ask, is to approve them for the current ask and then have them come back for a reconsideration with the additional enrollment number at a subsequent meeting. And that would allow the nursing education consultant the time to review the impact of the additional request to ensure that it doesn't have any effects on any of the other programs that are in that area, any of the other facilities in that area, et cetera. So that was not presented as part of the agenda item summary. It was not presented as part of the materials. So to have this ask come out today, the board can consider that, or the board can consider the current request, and then an additional increase, they can come back to a board at a subsequent date.
Yes, through this report, I'm only on page 100. I'm only seeing 90 as the annual enrollment.
That
So
is
that's-
correct.
Yeah, so that is what we can approve you for now. You will have to come in front of the board to request the additional, how many were 120?
Yes, it looks like when we submitted our original, our first feasibility study went in over a year ago, and we had to make some updates. And so we did make updates, but for some reason, the 90 got transferred over to the program summary on, I believe it was page 100. A couple of pages, I think 104 or 105, it does show the correct 120. So, and I'm not sure, when the last time we met with the ELC, we did bring that to the attention of our NEC, but it still, for some reason, is on the program summary.
So this is not the final step of the approval. And so I want to make sure that our board members and the public are aware of this. So there is still a secondary step with this, and that is the acceptance of the self-study that will come within approximately the next 6 months. If at that point, our nursing education consultant has a chance to review that and make sure that, you know, everything is still in compliance with all the rules and regulations, and all of the stuff that they are tasked with evaluating is in alignment with that, the agenda item summary that is put forth for the acceptance of the self-study could have asked for the board to consider the updated enrollment number. So this enrollment number right now is just that, yes, they can have a nursing program in this location with this current enrollment. It is not the end, and there is still a self-study that has to happen before they can start enrolling students. And so that may be something that our board considers, but also understand that there is an ability that we could bring them back before the acceptance of the self-study on request of the institution, and the NEC can do that evaluation. And if that meets everything, have an adjustment to the feasibility acceptance to include a change in that enrollment number. So a decision can be made today, but we do have several options that could also occur moving forward if the board so chooses to move those in those manners. Sorry.
Lori, do we have to adjust the motion?
No, the motion can stand the way that
For
it
the
is.
90?
The motion to accept and have the enrollment of 45 students twice a year for a
Yeah.
90 annual enrollment. That can stay. It can be, it would have to fail. So there was a motion and there was a second. And
Yes, there
in
was.
order for that to have a new motion put on the table, that initial motion has to fail. So if we were to go to a roll call vote, and if it were to fail, then the board can change the motion at that point to a different enrollment number, or this program can request to come back forward to a future meeting to adjust enrollment number to a larger number.
But if it does not fail,
Then it passes as an acceptance of a feasibility with 45 students twice a year for a total annual enrollment of 90. They pursue with the startup of a nursing program in that area, and then they will come back to us within the next 6 months if everything goes smoothly for acceptance of their self-study so that they can start enrolling students into their nursing program.
okay, we have a motion on the floor, a first and a second. We will now go to the vote. Dolores
Wait.
Trujillo votes yes. Board Member Jovita Dominguez,
Jovita Dominguez, yes.
Board Member Patricia Nguyen,
Win, yes.
Board Member David Lawler,
David Lawler, yes.
Board Member Allison Cormack,
Cormac, yes.
and Board Member Vicky Granowitz.
Granowitz, yes.
All right, the motion carried.
Thank you very much. We're going to move on to agenda item 8.6. This is discussion and possible action regarding a feasibility study for a new pre-licensure nursing program at Westcliff University for a proposed pre-licensure program with 2 tracks, a generic baccalaureate BSN program and an entry-level master's pre-licensure program. So Westcliff, first of all, their information starts on 110 in your packet. And board moderator, if you could please elevate the representatives from Westcliff. Westcliff came to the January-February ELC January board February 23 with this request to start a program. And the decision was deferred. They were asked to go back and identify an alternate site that was outside of the Los Angeles and San Diego region because of the impaction of that area. Westcliff did that. They went back and did some more work, and they are coming forward today proposing a relocation to Corona, California, which is located in Riverside County. Their enrollment request is for 80 baccalaureate students and 80 entry-level master's students, which is 160 students annually. Again, the agenda item summary is on 110. On 113, you can see data from Region 7, which is going to look a lot like the one prior, I believe, because they're both in a similar region. And the representatives are here should you have any questions.
And just for clarification, board moderator, the representatives are all here in public comment in San Diego. So you do not have to elevate them. I will just, they can wave, they're there. And if they have any questions that the board members would like to ask of them, they are here and I will allow them, I promise I will allow them to speak. So we can manage that this way. The biggest thing that I just really wanted to kind of touch bases on with here is that in February, this was a deferred action essentially on their feasibility. And the board asked them to find a location. Their original ask was in Irvine, Orange County area. And there was a large amount of clinical impaction. There was a lot of nursing program directors that came into public comment and started speaking up about how this would affect them. Westcliff followed what our board asked them to do. They did pursue a separate location prior to working and finding this location in Corona. And when they presented that next location, they worked with the NEC and it was noted that it was really just too close to the original area in Irvine and Orange County, and that it really wouldn't alleviate what the board was trying to alleviate. So they did go further east. They did find an area in Corona. They have secured some clinical placements close to them and do plan to move their clinicals to that location so that it does not affect the Orange County and Irvine, Greater LA area. And so following the board ask and working with the NEC, they are here and asking for acceptance of this feasibility study for approval of their program with both a BSN and an entry level degree option with 80 people enrolled annually for both of those.
Thank you, Lori. Any questions or comments from the board members? Board Member Patricia Nguyen.
Thank you very much. Thanks to the, to the applicants for taking our concerns into account and working to relocate to avoid impaction. I'm just wondering, and I don't know if this is for Marianne or to the program, but it does seem like this is a large number of new students coming in. Will there be enough clinical placements where they won't be dislocating other programs?
My understanding in working with the nursing education consultant is that they're planning to have clinical sites that are where their students live. So that's may or may not be, I don't know how far their students are going to travel, but they're planning to have clinical sites where their students live versus, like we look at the site. And of course, the program can speak to their thoughts on that.
Yeah, I'd love to just hear a little bit more about that. Thank you.
Of course, sure.
Yeah, real quick, we do have board member Vicki Granowitz here that does want to ask a question, and we do have the school here that'll be able to elaborate further on that. That was an updated business model. They do no longer plan to do that, but I'll let them speak on that more.
Yeah, this is Vicki Granowitz in San Diego, and I'm looking at the last page of the summary under clinical sites. And it says that the clinical placements are going to be in Orange County, West Hollywood, Garden Grove, Monrovia, Mission Hills, Orange, Burbank, and others are in the LA, Orange County area. These are all impacted areas. And so to me, this is still the same problem the last time you presented to us. So while you're saying you're using student zip codes, it's somewhat irrelevant because these are all impacted areas. I can't speak to Apple Valley because I don't really know where Apple Valley is, but all the rest of these are either in LA or Orange County. So,
and will you state your name? And can you guys hear him?
Everybody here okay?
Yes.
Perfect.
Dr. Matthew Hubbs, VP of Strategic Initiatives for Westcliff University. So what you're seeing is the culmination of a long effort that we've had here in pursuing now what will be our third and we hope final location for the program. So it's within our feasibility study, you'll see that we've sort of shown the progress of getting. However, we completely understand the board's concerns. We're grateful for the board for sharing those concerns, so we understand them because we want all stakeholders, including the board and our students, to be satisfied with our approach. So we have now redirected our efforts, as Ms. Melby mentioned earlier, to securing sites in the Inland Empire and specifically in the Corona and Western Riverside area. Apple Valley being the first one, which is in that Inland Empire area. But we have negotiations going on right now for Regional Medical, Arrowhead Regional, Kaiser and Riverside, San Gorgonio and Beaumont, where we'll be looking to secure sites. All have been positive thus far. We brought on a clinical liaison with experience in this area who's worked for many years securing clinical sites and managing clinical sites in this area. So our intent is that students will be doing their clinicals in this region. We have right now we have one acute, which is the Apple Valley. We have another acute that is within range, but still in what you consider an impacted area, but they have a partnership. I'm sorry, not a partnership. They have an extension of that in Corona. It's an intensive outpatient oncology for City of Hope, which will be providing clinical placements for our students. And as I mentioned earlier, those other locations are all acute sites that we expect to have shortly.
I guess that I'm confused about why you've come in now when you're not really ready, since you're still showing these as your clinical placements. And now you're saying you have other ones, which you may very well have, but it seems like your application is a little, from my estimation.
I think
I could
These are reflective of legacy.
Yeah, I can explain this to everybody in there. So with the nursing education consultants having to get materials to our board and through the review through myself and legal counsel and then out onto our website, sometimes the information that is submitted needs to be updated at a board meeting. And so the information that was submitted for materials was reflective of their prior approval and the other second location that they were looking at. And so since this material was put in and submitted and posted, there was an update. And the update was that they were securing additional location, additional sites in where the new brick and mortar campus location was, and that they were no longer pursuing any of the clinicals in the Orange County, Irvine area. And thank you, Vicki, for catching those. I caught those as well on review and immediately reached out to the school. And the NEC began working with them on that, saying, wait, you guys are to move locations, not keep clinicals in that current location. And that is when they actively started pursuing the clinicals in the new location. So they are in compliance. They have done the work that the board has asked for, and they did update that. And I'm just apologize that the materials had not been updated to reflect what has happened between the time frame of material submission to showing up today.
Any other questions or comments from board members? Board Member Allison Cormack.
Thank you, Chair Trujillo. This is I think, first a general question for staff and then a comment. How should we think about the tuition, the costs? I see that the applicant has indicated that they've reduced their tuition from the prior time, which sounds good, except it's on a high base. So just appreciate a little bit of, discussion on how we should think about the tuition for these decisions.
Perfect, thank you. And the board, the school, sorry, can answer questions specific on tuition if you'd like to, but I will do a general overview on that. So on our website, again, you can go to rn.ca.gov and you can go into a listing of all our academic institutions. Underneath the pre-licensure area, there is a tuition that is listed for every single nursing program out there. It goes as low as about $3,000 a year when you're looking at it from a community college standpoint, but it can also go to greater than $200,000 a year when you're looking at it from some of the private institutions. So I do want to let you know that they fall in more of the lower range for the private institutions when you look at that comparatively speaking. And so I'm pulling up the nursing education section on our website because I don't know everybody's tuition off the top of my head.
And no one expects you to.
Thank you. But the first one listing is Allen Hancock and it comes in at $3,588. The next one listed is American Career at $81,000. And you could scroll down and just see that it changes. And those are with associate degree programs, correct? So then when you move to the baccalaureate degree programs, you see that it jumps exponentially.
Right.
And then the first one that pops up on our listing is American University of Health Science. Again, these are in alphabetical order, not meant to call anybody out. And they clock in at 111,000. Angeles College follows at 103. So you can see that they're in alignment with many others. Azusa Pacific comes in at 59. So that is a little bit lower. But then as you go down to Cal Baptist, you're anywhere from 175 to 179. So you can see a sharp increase. And then when they talk about the entry-level masters, you have Azusa Pacific that pops in at 92, but then you have Seminole Merit that comes in at 170. And then USF and University of Pacific and Western University Health Science come in between the 125 and the 145 kind of range. So it is a consistent tuition that we do see. But it is good to see that when they did change locations, that they did look at adjusting the tuition. They adjusted the tuition down, and they actually adjusted their operating expenses up. So it looks like less of a profit margin that is occurring here. And if you have further questions on tuition specific related to this school, I can open it up to the representatives that are here. But if you're just looking at general tuition, it is on our website. It is very transparent. You can click on those links, take them to the website that the school offers that talks about individual education. And you will see a stark difference between public institutions that are community college versus the CSUs. There is quite a difference. You will see the difference with private universities. And then you'll also see a difference between what degree is granted, whether it's an associate degree, a bachelor's degree, or entry-level master's. And then some tuitions include fees for like NCLEX test prep, for books, for supplies, for uniforms, etc. And so you see those, they try to explain all of those on their individual websites.
Thank you. I don't have any further questions related to this specific application. But your answer of putting it in the context of other similar organizations was helpful. So I can imagine a member of the public who was trying to understand this might appreciate, having the NECs in the description say, is this the top third, middle, bottom, something that would just sort of orient the members of the public to where this falls within similar organizations.
Thank you. I
Thank
will
you.
pass that on, and we'll see what we can do to about including that in future agenda and item summaries.
Thank you. Any other questions or comments from board members? Okay. So I would like to make a motion to approve the feasibility study for a new pre-licensure nursing program, Westcliff University, 2 tracks, generic BSN and entry-level masters.
David Lawler, I second.
Thank you.
Just for clarification, that's with an enrollment pattern for each track of 80 annually. Is that accurate?
Yes.
Thank you.
BRN moderator, can you open it up for public comment, please?
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I would like to give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
Board moderator, there are no public comment requests in San Diego.
Thank you. Board President Trujillo, there are no public requests for comments on the WebEx. Board EO Melby has stated there are no public requests for comments in San Diego. Are there any public requests for comments in Sacramento?
There are no public requests for comments here in Sacramento.
Thank you. Would you like me to close this window?
Yes, please. Thank you. All right, we'll take it to a vote. Board Member Dolores Trujillo votes yes. Board Member Jovita Dominguez.
Jovita Dominguez, yes.
Board Member Patricia Nguyen.
Win, yes.
Board Member David Lawler.
David Lawler, yes.
Board Member Allison Cormack.
Cormac, yes.
And Board Member Vicky Granowitz.
Granowitz, yes.
Okay, motion carries. Thank you.
Okay, so we'll move on to 8.7. That is the NCLEX update. You can find that in the materials. We are continuing to stay with our normal patterns. There's nothing really specific that needs to be called out or addressed. Actually, it looks like That did not get included in the materials, did it? Oh, there it is. Sorry, just took me a minute to find it. And so with that, California is still coming in above the curve, or right with the curve, but at the top of the curve. Not bragging at all. But with that, we're still doing well with our NCLEX pass rates. I do want to make sure that the board is aware that there can be an expected dip in some pass rates, but it is a small percentage. Brendan, who was talking from NCSBN earlier, I was meeting with him and kind of discussing the trend with NCLEX because they did start a new NCLEX, it's called Next Gen on April 1st. And with that, you do have an expectation that some NCLEX pass rates may change as they adjust to the new testing. The one thing that I'm hearing from NCSBN, which of course works with Pearson VUE, that is a company that is incorporated within them, that they haven't seen much of a change. And so that people are transitioning to the next gen very well, and that drop is not there. We did also discuss the effects of COVID on NCLEX pass rates and if there was a drop that did occur. And they said overall it was about a 6% drop that they saw in NCLEX pass rates. So if somebody was having 100% pass rates, they might drop down to about a 94% pass rate. If somebody, of course, was an 81% pass rate, they drop down to maybe 75. When it comes into concern with our board is, in line with our regulations, is anything that's under 75. When we're looking at accreditation, they look at 80% or above. But right now we're doing very well in California overall and still maintaining pass rates in the 90s for the majority of our schools as a median.
Thank you, Lori.
Thank you.
And 8.8, licensing update.
Yes, 8.8 is a licensing update, and we'll do public comment on both of these at the same time because they are both information only and very much aligned. Throughout this board meeting, we've talked about just different licensing and getting more endorsement apps and such going on. And I just wanted to make sure that you guys are aware that that is continuing here. Our licensing process continues to grow. Our licensing continues to work on streamlining efforts and speeding them up. There are still further information that is coming out on APRN. And as we learn more about the APRN process, we tend to address more. So with that, we do plan to continue to streamline that, roll things out. We will send messages out to licensees and update our website when those come to fruition. But there are some information here that if you guys wanted to discuss, we absolutely can. But it is just a general report, nothing that is outstanding, nothing that caught my attention as being abnormal that needed to be addressed specifically. But just want to share out the information for board members. And if you guys have any questions, I'm here to answer them.
Thank you, Lori. Board member Allison Cormack.
Thank you, Chair Trujillo. Thank you, Ms. Melby, for providing this helpful information and answering in advance the question on 8.7, which is, you can see where it goes down by about that exact amount. So I'm on page 127 now. And I guess my question is less about California under the RN exam, the average processing time, and more about the US. It looks like they, as a nation, we were able to cut the processing time in half. So any thoughts on what we might be able to learn from other states to the extent that you know?
I'm not sure that I followed.
So I'm in 8.8 and I'm in the table and I'm in the second part of the table where you can see that we made good progress a year ago and are continuing in a good trend for the current fiscal year. But the US went from 31 days to process last year, 2 years ago, to 14. So I'm just curious about what other states obviously must have done to shorten their processing time.
So those are actually our processing times.
The
And I'm
US
sorry
one?
that wasn't clear. Yes.
Oh,
And so
that wasn't clear
it's
to me.
and I apologize so much. So let me try to explain. We have two different ways to come into California to get licensed. One is licensed by exam and one is licensed by endorsement. Those are the two ways. Then we further separate those down into whether they're the California applicants, whether they're United States applicants, or whether they're international applicants. So when you look at the RN exam, those are all ours. Those are our processing times for each one of those areas. But what it's broken down is, did you graduate from a California board approved program? Or did you come from a other state where you graduated from their board approved program? Because each one of the states in the nation approve their own nursing programs. And then, so they may have graduated from Arizona State University and then applied for licensure for their initial nursing licensure in California, even though they graduated in Arizona. And so that is what you would see as US RN exam. And
Okay.
those we've managed to decrease from 31 days down to 14 days. So that is our processing time. Additionally, when you look at the international under the RN exam, the international applicants, that again is our processing time, it has increased. It went from 60 to 66 to now 69 days. And what that means is a student went to a program located outside of the United States, and they want to take their NCLEX for the first time through approval from California's board. And so they apply to us, they submit transcripts from every school that they attended. They have to give us information on that school. They have to give us information on whether or not they attended in-person clinicals. A lot of times that's verified through, travel, visa travel. There's a lot of things that are done to verify the international programs. And then once we've verified that they are potentially not fraudulent, and that they do meet all of our California rules and regs, then we can give them what's called an authorization to test. And then based on that, it's submitted to Pearson VUE. They then can take their NCLEX. If they pass, they then are issued a license through us as an exam state is how it's qualified. And then they can endorse to another state to be licensed if they choose to. The second section, which is RN endorsements, what that means is they were licensed in another United States or they were licensed internationally, and they're asking to come to California based on the idea that their education meets our same standards and that their background meets our same standards and that they have passed the NCLEX through a different state that served as their exam state, and then we would be considered the endorsing state.
Okay. I still don't quite understand why it takes us longer to process students who went to school in California than it takes to process students who went to school elsewhere.
I can explain that one as well. So working with our program directors, we had prior ask that they have their students apply 8 weeks prior to graduation. And that was to facilitate a very lengthy process that we used to have. And part of that lengthy process is they would have to print out individual paper transcripts, sign, emboss, and endorse every single one of them, and then overnight mail them to our board, when our board would go through every single transcript and every single transfer credit that program would accept to meet our licensing requirements. That is no longer the process. However, we still have applicants applying 8 weeks in advance of graduation. So we have asked for a IT update. One of those Breeze IT updates will be where they enter their graduation date. And so then at that point, even if they applied 3 months in advance of their graduation, we would not start ticking our clock until at least graduation. Just so that everybody is 100% aware of our license by exam through California grad process, we have about a 48-hour processing times on that. And I'll explain what that means. They apply, they pay their fee, they complete their live scan, and then it is submitted to us. Based on school code, it is sorted and an email is sent out to the program director. That program director is able to enter into a portal. It is a secure portal. They do have access granted to them by our licensing team with verification by the NEC, who has already approved all curriculum, etc. And so once that nursing program director enters that portal, all they have to do is click about 2 or 3 buttons that says, yes, this student has met the licensing requirements for education. That 24 hours later is submitted to Pearson VUE as an authorization to test. And then as soon as that student schedules their exam, takes the exam and passes the exam, those results are sent to us within 24 hours and the license is issued if their live scan fingerprints have come back and they're clear. And so at that point for board work, it's about 48 hours turnaround time. It's the first 24 hours to get that data sent to Pearson VUE and the next 24 hours to receive that data back from Pearson VUE. That does extend if there is any background issues that are discovered. If background issues are discovered, they can still test, but they cannot be licensed until that has had a thorough review through our enforcement department and determines on whether or not public safety is met and they can still be licensed here.
I think you should put a big asterisk by that and then put your answer down in the bottom, a little footnote that's like, it only takes us 48 hours and then 24 hours, but we're trying to convince people that they shouldn't apply early because we've fixed a process. So
we are.
You deserve a lot of credit for fixing it. And it looks like it will soon be reflected in the numbers.
It will.
I would just say that and this is probably the right place to say it, that one of the things I thought about in reviewing this and trying desperately to get up to speed is that it might be helpful, again, now that things are more stable than they had been, to identify a handful of metrics. And whether this is one of them or not, I don't know. Collectively, perhaps the staff comes up with it. I don't know what the right process is that would be reported consistently, either here or in the executive officer summary at the beginning, so that rather than sort of delving into the details, we'd have top line metrics that would help us sort of, see the progress that we're making and where opportunities need to occur. So thank you for walking through that. And I think that, there's an opportunity to choose those wisely.
Absolutely. Thank you. Okay, so
Lori, were you about to say
yes,
something?
I was just going to say that the report outs for both are information only. There is no motion that's needed, so you could open up to public comment.
Well,
Choose to.
Pierre and moderator, will you please open up for public comment? Thank you.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and will move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
And board moderator, just let you know that we no longer have public participants located in San Diego. The 3 public members that we had here were Westcliff, and since that agenda item has been completed, they have left. So we have no public participation at all in San Diego at this point.
Thank you. Board President Trujillo, there are no public requests for comments on the WebEx. Board EO Melby has stated there is no public representation in San Diego. Are there any public requests for comments in Sacramento?
There are no public requests for comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, thank you. At this time, I would like to request a bio break of 10 minutes. Thank you. So we will come back at 3 o'clock.
Thank you. We're on and up and running in San Diego.
I believe we're on here also. Do I need to check to see if there's another quorum needed? Roll call?
If we could just run through and make sure everybody's still,
Sure.
everybody that was
I can
here
do
is.
that. Dolores Trujillo is present. Board Member Jovita Dominguez.
Jovita Dominguez present.
Board Member Patricia Nguyen.
Win present.
Board Member David Lawler.
David Lawler, present.
Board Member Allison Cormack.
Cormac present.
Board Member Vicky Granowitz.
Granowitz present.
Thank you. We have a quorum. Moving on in the agenda, we're at item 9.0. This is the report of the Enforcement Intervention Committee. 9.1, information only, enforcement and investigation update. Is Shannon here?
There we go. I was just waiting to be unmuted. Hi,
Thank you,
everybody. Good
Shannon.
afternoon. We will start with 9.1. Everybody can hear me okay?
Yes.
Okay, great. So 9.1, this is the Enforcement Intervention and Investigation Update. There's not a lot to report on. I'll kind of go over some items that we're still have some ongoing things going on. So we did start the process with National Council and CSVN in the 5-year study. So that's still ongoing. We are still working with OIO, which is the organizational or the Office of Organizational Improvement, and we are still mapping out all of our processes within enforcement. We've completed complaint intake and probation. They are currently working on our legal desk, which is the desk that processes all of our cases, and as well as our citations desk. We are continuing to, and always will be probably, recruiting expert practice consultants. One new item that we did do is we created a new flyer, and that flyer is currently being distributed out to facilities, so we can try and reach out to those nurses in the facilities that are interested in becoming an expert. We're also going to be coordinating a virtual presentation that will be given to assist with the recruitment efforts as well. And of course, the new flyer is on our website. And we also still ask the question of RNs when they're renewing their license if they are interested in becoming an expert. So we're trying to reach all efforts, and we're also posting that flyer on our social media sites as well. For discipline, as of the beginning of August, we still had just about 11% of our cases pending over at the AG, over 1 year old, and which is pretty good for us, especially going through COVID. We've been able to maintain the probation unit. Like I said, they just got finished with OIO and doing all the mapping of their processes. So we're looking at items and areas to see where we need to update. We also, I'm very happy to say, we have obtained a new enforcement nursing education consultant, and she's settling in right now, trying to learn her role and assisting probation with approving employment, as well as assigning and reviewing courses for the conditions of probation. Our intervention unit is, we're continuing to work on that. Yvonne, our Assistant Executive Officer, myself, and Jaspreet Pabla, who is the Deputy Chief, are currently attending the IEC meetings to sit in. We're trying to identify areas where we can streamline some of the processes and really kind of train the IEC members. If you're aware, we just did a big push, and we just recently, over the last 7 to 9 months or so, appointed several new IEC members. So we're trying to sit in those meetings, train, identify areas that need to be updated possibly. And so we're currently doing that as well. And we also have, if you'll notice, this box under the intervention section on 9.1 used to be very large, but because of all of our recruitment efforts and the board appointing those IEC members, it looks like we have about 7 vacancies right now, which is Sacramento, Central Valley, Inland Empire, San Francisco, and then the Superior California area. And those are both nurse and physician members. We do not have any public member vacancies right now. However, if in 9.2 there are some to be appointed, and if we do, the board does vote to appoint those members, then this list will go down even more, which I'm very happy about. So we're coming close to having all of our vacancies filled. The statistics that you have are the same ones that you've seen. These are from as of 8/2. And so that is table A. They're under table A, excuse me, there's some graphs. There's 3 tables with graphs, and that is based on the data in table A. Then you have table B, which is a complete fiscal year by month, showing the timeframes of cases. And I just want to explain this a little bit too, because it doesn't say at the top of this header. This information can actually be pulled from DCA's website. They have a data tab, and in the data tab, it gives a lot of our enforcement measure information. But these are timeframes. So basically, if you're looking at the total average, which is the top row, it's at 934 cases that we actually referred for discipline to the AG's office. And then the intake time was on average 7 days. Investigation time is 341 days. Pre-AG time is 12 days. And when I say pre-AG time, that's the time from the investigation closing until we refer it to the AG's office. So, and then you have post-AG time, which includes the time of referral all the way through the final decision being made effective. So that includes the board vote, the processing time for the legal desk and everything. So looking at table B, you can really see where the chunks of our time really come from when you're looking at case aging, and it's the investigation time and the AG time mostly. And then that last column is our average cycle time. And that is it for 9.1. Does anybody have any questions?
Yes, Board Member Patricia Nguyen.
Yeah, hi Shannon, thank you so much.
Hi.
This is a really detailed and great report. I have just a couple of, one question and, well, I guess 2 questions. The first is, could you explain to me what our relationship is to Maximus? I mean, I have been reading the cases, so of course I do see how, you know, there are interventions and, you know, it seems like a very rigorous program, but I would love to understand that a little bit better.
Maximus is our third-party contractor. So, and it's under the DCA. So there's 7 other boards. We are under contract with Maximus to oversee our intervention programs. So for instance, the Board of Pharmacy has a program, Dental Board has a program, Dental Hygiene Board has a program. And so all of those boards under DCA, Maximus is the contractor who oversees that program for us. They have the case managers, which are all clinicians, RNs, and they interact mostly with our participants in our program. They have the database that houses all of the data and information for us. That's where the participants check in. And that's who Maximus is. And they oversee and kind of coordinate a lot of our meetings for us, for the participants. They create the contracts for the participants. So basically everything. And you can find their contract online if you're really interested in what Maximus provides us.
I think that your explanation is detailed enough. I appreciate that. I understand it a little bit better now. The second question I have is on page 7 of your report. The number of, and it's in the complaint intake. So when there are complaints pending, it looks like we have 1,578. And the ones that, go a year or longer are 381. But when there are convictions or arrests, 868, and those that go a year or longer at 309. And those cases seem a little bit, well, now that I'm reading it, it says pending, but I was thinking.
Are you looking at table, I'm sorry, Tricia, are you looking at table A?
Table A.
Okay, and you're
Table
looking
A.
at the complaint
Under
intake section?
Complaint intake. I'm looking at the timeline for the complaint intake. Seems like the cases, complaints would be harder to, deal with than convictions. I mean, convictions seem like more of a, open and shut case. I'm wondering why so many
Our
of them take so long.
our convictions are considered paper cases, and so are out-of-state discipline cases. They're considered paper cases because we just need, for, of course, a conviction, we need the arrest and the conviction documents, and then we only need the out-of-state discipline document, which you can find a certified copy of that on nurses. So those are very easy for us to get. They're usually cases that move very fast. Several years ago, we started a project with the Attorney General's office where they dedicated certain deputy attorney generals to those cases, and we call them fast track cases. And we can usually have them open and closed within, from the time the complaint opens and to close was about 6 to 9 months. But then COVID hit, and we were having a really hard time getting our conviction docs from the courthouses because they all closed down, and a lot of those courthouses did not have an electronic record system set up yet. So that a lot of our conviction cases kind of had to be put on hold for a minute until we could get those documents.
Great. Okay.
So
Yeah,
so
that
that's
makes
kind of
sense.
what happened with them. We're getting back on track. All the courthouses are open, but our numbers are based on closures. So these are cases that have closed. So as we kind of move forward, the numbers will start getting better as far as the arrest and court docs. And you're correct. So everything else is considered a public complaint. And those, for the most part, have to be investigated. So those will go to either the BRN investigations unit or to D of I.
Thank you. Very helpful. And then my last comment is just, I hope that you will consider agendizing enlightened enforcement and maybe get us up to speed a little bit on what that project is doing. And that doesn't, I'm not asking for a fast track on that. Just
Oh, no,
when you
I
have
would
a
chance. Love to do that. They've just started doing some presentations. They haven't really dove as deep into it yet, but once we start getting there and I have some information I can share, I'm definitely going to share it with the board.
And then Trish, I'll jump in really quick. That is a DCA project. And so similarly to the Enlighten License project, we were not allowed to release out until DCA cleared the ability to release any results. So it may be a while before we're able to release any results of that enlightened enforcement project, but we can definitely talk about the purpose of it.
Thank you. I understand. Thank you very much.
Thank you.
Board Member Allison Cormack.
Thank you, Board Chair Trujillo. Ms. Johnson, nice to meet you electronically.
Nice to meet you too.
I wonder, as you're talking about trying to recruit additional EPCs, and this may not even be a question for you, it may be for Ms. Melby, does the BRN send out a newsletter to licensed nurses in the state of California?
We do. We do have a BRN report that goes out, but we also have active recruitment going out in other ways for the EPC. It is a very stringent criteria that needs to be met. And we have many participants already, but always can take more. And they are contracted in with us and they do receive a stipend.
Just
And-
occurs to me, it's the kind of thing where you could profile one of the EPCs in the newsletter, so people would get a sense of, you know, who does the kind of work and what it takes. You've probably already done that, so.
We do. We posted in those newsletters. We posted on our social media, and now with the recruitment efforts with the new flyers that we've created going out. But there are some areas like listed on agenda item 9.1 that we definitely need additional assistance in. And two of the really big ones is the long-term care, the SNFs. We have limited in those areas, as well as the med spas with the cosmetic, Botox, laser. So those two arenas, you know, there's some others listed, but I know those two specifically are probably our two lowest. There's information, again, you know, it's always posted here in the agenda items with the links if anyone's ever interested in becoming or looking at the criteria. And just to remind everyone, the criteria is that they have to be a registered nurse for at least 10 years. They have to be currently working in the field that they're going to be opining in for at least 5 without any discipline on their license.
So understandable, you need specialists. That's harder
Yeah.
to find. Yeah.
Yes.
Okay.
Yeah.
And then page 9. So not great news that 54% are, you know, above the goal. And I know the OIO is doing work, and I'm sure there are a lot of things going on. What are like the top 2 things that are going to help us meet that DCA goal?
To be honest, you know, that this is a topic a lot with enforcement, with the boards. I know DCA is, you know, we talk about it. Is the CPI 540 days achievable? And I normally have a table in here. I didn't put it this time. It shows all the different boards compared to where BRN is. We are the board that has the most amount of complaints that come in through all the healing arts boards. And we are one of the, I think we're the 3rd lowest in processing times. So the 540, we talk about whether that's really even achievable or not. Is that a number that we really need to talk about, and should it be changed? So that conversation does come up a lot. We get very close sometimes, as you can see in table B. You know, if you look at a certain month, some of those months, you know, we get down to 586 days. So we're getting close, but on average, if you look at the whole fiscal year, you know, we're more about probably 6 months from that goal on average. But I would like to see it. We strive so hard, even if we can sliver, you know, a day or 2 off in a certain area, those days add up. They really do add up when, you know, when it all comes down to the end, and when you're closing out that case. Believe me, I'd love to see that number lower, and we're really, really striving to get there, but I don't know that 540 is really achievable.
Yeah, absolutely fair to, you know, to make sure we understand the goal. And especially when it's an average across such different cases, I think, you know, averages can, you know, mask a lot of other things.
I believe, real quick as well to interject, I believe that when the completion of the Enlighten Enforcement project is completed, they'll have probably a new recommendation for that timeline. I did meet with an auditor from DCA, and one of the conversations around that was that they too think that 540 days may not be attainable, and that it may need to be adjusted. With that, those 540 days, and Shannon, you can elaborate more on this, takes in court time as well, and is really outside of their
Not in our control. If you look at on average, we're at about 300 days for a court for a hearing, and we're at about 300 days average, you know, depending on which investigative body has it, BRN or DFI. So on average, I mean, if it has to go to investigations and then it goes to hearing, you're already looking at 600 days on average. So we're already over the 540. So there's some areas that we really need to, you know, and those 2 items are out of our hands at that point.
Right.
Yeah.
Right. Okay. Thank you so much.
You're welcome.
Any other comments or questions from board members? All right, why don't we do 9.2 and then we'll open it up for
Want to
public
do
comment.
public, oh, you're going to do public comment after?
Yeah.
It is
so-
information only, so
Yeah,
yeah,
okay.
maybe worth that.
Okay, so agenda item 9.2, this is the discussion and possible action regarding the appointment of our intervention evaluation committee members. We have 5 this time. Dean Rischel for the public member seat in IEC 1, Holly Carlson, the nurse member, IEC 1, Alexis Watson, nurse member in IEC 5, Nancy DeWitt, a nurse member in IEC 9, and Alexis Blount, a nurse member in IEC 12. And then the term expiration, sorry, I should have said those. So for Dean, it would be 6/30/2027, Holly, 9/30/2027. Alexis Watson would be 6/30/2026. Nancy DeWitt, 6/30/2027, and Alexis Blount would be 6/30/2025. And so can I get a
Just
motion?
there was for IEC number 4 on DeWitt, it's actually Nicole, not Nancy. That was
Oh, is that a typo?
it is, yes, I apologize for that.
Okay.
I believe it was corrected in the agenda item summary.
Okay, any questions or comments from board members? No? Any questions or comments from our board member in San Diego, Vicki Granowitz?
Granowitz, no.
All right. Okay, so we need to make a motion, correct, to accept these committee members.
Correct.
So I would like to make a motion to accept the new committee members listed in agenda item 9.2. Accept the appointment of intervention evaluation committee members.
David Lawler, I second.
Thank you, David. VRN moderator, can you open it up for public comment, please? And we will
We
be
will be
doing
opening.
9.1 and 9.2 in public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. Board EL Melby has stated that there are no public representation in
Correct.
San Diego. Are there any public requests for comments in Sacramento?
There are no requests for public comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, thank you. All right, we'll vote on the motion. Dolores Trujillo votes yes. Board Member Jovita Dominguez.
Jovita Dominguez, yes.
Board Member Patricia Nguyen.
Win, yes.
Board Member David Lawler.
David Lawler, yes.
Board Member Allison Cormack.
Cormac, yes.
And Board Member Vicki Granowitz.
Granowitz, yes.
Thank you. So moving on to the next agenda item. This is the report on from the Legislative Committee. An update, and Marissa Clark is making her way to the front.
I know. I love it. Hello again. All righty. So there are only two bills to go over today, so I'll jump right into those. The first is Assembly Bill 1695 by Assemblymember Gibson. And this bill would establish the Nursing Pathway Pilot Program. So just high level, it would require the Department of Education to allocate funding to high schools selected through a competitive application process for the purpose of creating career pathways that move students towards an associate degree in nursing at a partnering community college. So this bill was last discussed by the board at the May meeting, where members took a support if amended position. And the main request was that generally like the bill, but would like to see involvement from the board itself kind of in the development. So the main rationale was just to make sure that public protection is taken into account and of course adherence with the NPA or Nursing Practice Act. So I reached out to the author's office. The sponsors both very kindly agreed with our suggestions. So the bill has since been amended and it has the following two new provisions to reflect our asks. The bill now requires the Superintendent of Public Instruction or Department of Education to consult with the board during the development of the competitive application process to ensure its alignment with California's Nursing Practice Act. And the bill requires the board to review and approve any nursing course curriculum provided as a part of the pilot program to also ensure its alignment with California's Nursing Practice Act. So it would have us involved both on the development of the application process, and then once they're submitted, we would have some involvement in looking through those course curriculum as well, which is very similar to what community colleges already do with us. So yeah, since the board previously took the support if amended, and it was subsequently amended with the request, I wanted to bring it back for you all for reconsideration if you wanted to change a position.
Thank you, Marissa. Are there any questions or comments from board members? Board member Allison Cormack.
Thank you, Chair Trujillo. And as I get up to speed here, I guess, first of all, I appreciate that the amendments have been incorporated. Thank you for working on that and to the author for accepting it. How much money is available in the CTE incentive grants?
In the
So it looks like that's where the money would come from. Is it?
So the bill actually, that's a great question. And I had a note to bring that up. So thank you. There are several funding streams already for career technical education. There's some federal ones, which are a little bit smaller, like Perkins. And then there's ones like CTIG, which are pretty large. This actually, the bill had written in that it was subject to a separate appropriation. So that at the time we last discussed it, it was kind of like, well, we could get to the point where everything looks great, but if there's not a corresponding budget item, the good news is there was a corresponding budget item that an ask was put forward, and I believe is about $60 million per year for the next 5 years, go to the community colleges just to kind of recruit, retain, and grow their nursing programs. There were a couple other bills that are still moving that have to do with the community college nursing program. So I think that money's going to be allocated to multiple, but my understanding is that this bill was part of that ask because the people who put forward that budget ask were also behind this bill. So there is a supplementary.
There is associated funding. Great, thank you.
Any other questions or comments from board members? Any questions or comments from our board member in San Diego? Vicki Granowitz?
Granowitz, no.
Thank you. All right, at this time, I would like to make a motion that we change our support, if amended, to support this bill.
Win seconds.
Thank you. We'll go ahead with the second bill, and then we'll open it up for public comment.
So the second bill is Senate Bill 544 by Senator Laird. And this bill would make certain changes to the Bagley-Keene Open Meeting Act, which is our state law that governs public meetings of all state boards and commissions. More specifically, the bill establishes certain stipulations for conducting public meetings via teleconference or another remote platform. So we last discussed this bill at our April board meeting, where members took a support seeking amendments position with a request that the bill include an urgency clause so that its provisions would take effect upon signature rather than January 1st. Since then, the bill has actually been amended twice. The first round of amendments did not significantly change the overall intent of the bill. However, the most recent round of amendments did make a more substantial change, which is why we're bringing it back all before you again. And just a quick note in the bill analysis, it outlines the majority of the amendments that have taken place, but the last couple took place after the meeting material deadline. So I'm going to go through all of them, and then I'll specify the extra 2 that weren't in the bill analysis, but have since been added that are a little bit more significant. So since our last discussion, the bill now has just further clarified that its provisions do not change the requirement for a state body to post a meeting notice and agenda online at least 10 days in advance of the meeting, as well as at any physical location designated in the meeting notice. The bill would prohibit the meeting notice and agenda from disclosing information regarding any remote location from which a member is participating. States that members of the public shall be entitled to exercise their right to directly address the state body during the teleconference meeting without being required to submit public comments prior to the meeting or in writing. Requires a state body, upon discovering that any of the means of remote participation required by the bill have failed during a meeting and cannot be restored, to end or adjourn the meeting in accordance with prescribed adjournment and notice provisions, including providing information about reconvening. The bill now requires a member of a state body who attends a meeting by teleconference from a remote location to disclose whether any individuals 18 years or older are present in the room at the remote location with the member and the general nature of the member's relationship with any such individuals. And these are the last 2 provisions that were recently added that aren't in the analysis. The bill does now require that a majority of the members or a quorum of the state body be present at one physical location for a minimum of 50% of the meetings of the state body each year. So going from allowing complete teleconference to having at least half in person. And then they also added a sunset date of January 1st, 2026. So if this bill were to pass, it would go into effect Jan 1, 2024. So it would be there for about 2 years, subject to any further legislation to extend it. I'm so happy to answer any questions because I know this bill's gone on a bit of a journey since we've talked about it last.
Any questions or comments from board members? Allison Cormack?
Thank you, Chair Trujillo. Allison Cormack speaking, which I realize I haven't been saying, but I've been recognized. So hopefully the note takers can keep up with that. All right, yeah, we've been through so many different versions of this over COVID. So let me just test my understanding. The current version of the bill, and we'll just use us as an example, says 50% of the meetings. So is that the statutory 4 meetings or all of the 8 meetings, including the committees?
That is actually a question that has been asked that is unclear. I believe the language in terms of how it would apply to us, because we have advisory bodies and subcommittees. I believe the language in the bill says 50% of the meetings of the state body. Well, I think one of the first questions we asked internally was, does that include subcommittees and advisory? And we didn't know that quite yet. I think we would hope it would be the full board, but we don't know. So at least from the BRN perspective, given how many advisory and subcommittee, that could mean a very significant amount.
Okay, so, well, let's just assume what we know, which would be the 4 statutory meetings. So 2 of those 4 meetings have to have a quorum of members. Quorum is of the number of appointed members or of the 9?
Of the total, majority of the total board.
Appointed?
Yes.
In place, okay. In one.
Oh, no, sorry.
No. Yeah.
Oh, sorry. My mistake.
Okay. I'm not sure if that your microphone was on.
Sorry, this is Matthew Yates. I'm Deputy Chief of Board Operations. For the Board of Registered Nursing, we're 9 members. A quorum for our board would be 5 members.
Okay. And so in one place means like we've just, if this new law were to go in effect, we've just barely made it with 5 of us here and 1 somewhere else. Okay. But this also means then for 2 of the meetings, it's possible that no board members would be present.
Correct. So
And a staff member would sort of represent it.
Yes.
Okay, so I'll just make a comment here, which is I probably won't support a motion to support this bill. Having been through all in person, all remote, some hybrid like this, some hybrid where the public had to come in person but couldn't call. And I'm a firm believer that, at least at the board member level, being in person is a benefit to each of us as board members, and it is a benefit to the public to be able to come and see us in person. So I certainly understand that people have gotten used to having flexibility, and of course things arise, but I'm not comfortable that, let's say if there's 7 of us now and there's 4 meetings, that's 28 times that we need to show up, but under this it would just be 10, right? That's a lot. I may not have done that math fast enough correctly, but I'm just saying there'd be so few times that members of the public could see us together working, and I feel that's a really important part of this job. Even though I understand that it's a burden to travel and that it's expensive, for me, the public benefit outweighs that. So that's where I am.
Thank you, Allison. Board Member Patricia Nguyen.
Thank you very much for sharing that perspective. I appreciate it very much. I'm a very social person, and I see the benefit of this, but I also have watched during COVID how much public participation we have gotten using technology. And at first I was one of those, oh, I hate Zoom. And, it transformed our lives. It connected us in ways that I couldn't have imagined. I've watched for the last 2 years how many people have participated in very meaningful ways on Zoom. And I'm looking at our room, and it's really great to see you all. But, we've had 150 people pretty regularly on Zoom meetings. So we have adapted. So I would agree with you that it's beneficial, but I no longer believe it's essential. So I will be supporting this bill as it's written.
This is Vicky in San Diego. I agree with Tricia. Additionally, as somebody that lives with a chronic illness, I think that there's something to be persuaded in the section where they talk about the benefit to the disabled, people that are ill. It allows them to participate in ways that someone like me during times of illness, I might be able to sit at home on a computer, but I wouldn't be able to make it to a meeting. And so it is a way to help those that are disabled to participate additionally. So I will support. And I like the idea that at a minimum, you have to have 5 people in one location. I think that was what it was. So the public can still see people, the majority. So I think this iteration of the bill really tries to walk a fine line of acknowledging both realities. So I'll support it.
I'm not sure if you guys saw what happened with the greater view here versus these up close personal views of our video. But we did have a public member here. There were 3 that did arrive to this location. They were agendaized, so it wasn't a true kind of public member that was coming in just to kind of opine on something aboard business. They had a financial gain of such to be here and be present. But one of those members was coughing and sniffling and was very closely located to Vicky, who does have a chronic illness. And so that was a little concerning for her. And she did attempt to move away. And then I'm sure you guys saw as soon as they left, she stood up with some Clorox cleaning wipes and wiped down the table because she did not want to become ill. And so I do see the benefit of having a flexibility. so that people that would not be able to normally participate as a public servant in a board or such does have the ability to do that as part of maybe similar to like an ADA accommodations of some sort. So I do think that that's a good thing. It would be a benefit to get clarification, truly. We have at last count, and I'm sure I'm going to get this wrong, 11 IECs that meet 4 times a year. Those are advisory committees, and so that is 44 meetings a year. Each one of those have 5 members, and so we manage that very large number of multiple people trying to come together. In addition, we have 5 advisory committees, 4 of them having between 6 and 7 members each, and then 1 with a larger member participation of about 16. So, and then we have those that meet at least 2 to 3 times a year on each of those 5. And so we have another 15 meetings. And so we're at, 44 and 15, we're pushing close to 60 meetings a year. And then that's not including our board committees and our board meetings, who at minimum, that's another 8. So our board is quite busy. We tend to meet just minimally about 80 meetings a year. And that's a lot for our staff to manage. That is a lot of public participation, but we are happy to follow the law that comes in front of us. But I will be happy to support any law that allows us to have some flexibility on that, just from an operational standpoint. Prior to COVID, we had maybe, 20 people that would show up. And of those people, they were typically nursing programs that were agendized and we required them to attend. And then we would open it up to students as well and encourage them to come. But since COVID, we have some meetings that have over 200 in attendance. Today we had greater than 100 in attendance, and sitting right now, we have 74 attendees and 8 panelists, or 82 participants. We truly do open this up in this way. And even if this bill does not pass and we go back to the full Begley-Keene, which is what we're operating on now, we will continue to offer a virtual component that will always be a part of every one of our board and committee meetings going forward, because we have seen the benefit of that.
Thank you, Lori. Any other questions or comments from board members? Thank you. I would like to make a motion to change our support. Well, we're already supporting it, right, Marissa?
It was
Yeah,
supposed-
so we don't need a motion
well, it is
to continue it. Okay.
significantly different version, so.
All right. So I'd like to make a motion to continue to support this Begley-Keene bill as written with amendments. Do I have a second?
David
I'll
Lawler.
second it. This is Vicki Ingram. It's
Thank you,
in
Vicki.
San Diego.
Sorry, this is Reza. To be clear, you said something about amendments, Dolores?
Well, there were
specifically
2, it's not really, I'm sorry, not amendments, but there were 2 additions that were not in the AIS that Marissa spoke about.
You mean just then the current version of the bill to
Correct.
support that? Gotcha.
Okay, before we vote, let's open it up for public comment.
We will be opening for public comment now. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Board President Trujillo, there are no public requests for comments on the WebEx. There is no public representation in San Diego. Are there any public requests for comments in Sacramento?
Yes, we have one request for public comment.
Hi, this is Kathy Hughes. I'm a registered nurse and the executive director of the Nurse Alliance of SEIU California. The Nurse Alliance did make a recommendation to our SEIU California, representing about 700,000 union members across the state, to support AB 1695 with the amendment. So I'm proud to say that SEIU California is now on record as in support of that bill. And that had to do with me attending the BRN meetings and making the recommendation that the Board of Registered Nursing be a part of that. So I'm just really excited about that. And then don't have a position on SB 554 only because there's only so many bills that I personally can follow. I totally get the in-person thing. That's why I'm here, is I've never met the board members in person. So it was really nice to kind of see each other, say hello while we were waiting for lunch and that kind of thing. So I get the whole relationship building part of that. Our meetings, I have a 26-member e-board, and we meet every other month, and we now do a hybrid where a lot of the members attend in person, but many of them can't. Some of them are immunocompromised. It also opens it up to retired members and members that the locals don't sponsor travel for. I'm blessed in that this is part of my job, so my employer covers my travel. But if I were truly just a public member, I would have to attend virtually because I wouldn't be able to afford the personal travel. So I get the hybrid and do appreciate both the opportunity to be here in person and see all of you, and then the fact that there are times when I might not be able to travel and I could still participate. Thank you very much.
Thank you. Are there any other public requests for comments in Sacramento?
There are no other requests for public comment here in Sacramento.
Thank you. Would you like me to close this window?
Yes, thank you. Okay, we will vote on the motion that's on the floor. Dolores Trujillo votes yes. Board Member Jovita Dominguez.
I vote yes.
Board Member Patricia Nguyen. Board Member David Lawler.
David Lawler, yes.
Board Member Allison Cormack.
Cormack votes yes on 1 and no on 2.
Thank you. The no was for the Bagley-Keene.
Yes, the one that's listed as 10.2.
Okay, thank you.
SB 544.
Thank you. And Board Member Vicky Granowitz.
Granowitz votes yes.
Thank you. I believe this ends our agenda for the day.
It ends our public agenda for today.
Public agenda.
We are at
for the day.
10.0. That does wrap up the public section of our board, and we would go into closed session. Reza, did you want to do the announcement regarding closed session and that all of that stuff that surrounds that?
You mean that we are not going to be conducting any business afterwards? Okay.
Correct.
So yes, the last substantive item to be conducted in open session is the legislative material that we just discussed. So all that's left is closed session. Therefore, if we proceed to conclude that after hours today, I don't believe we're going to be returning back into open session. Is that so? There is no more for members of our public who are in attendance. There is no more material to be discussed in open session.
Thank you, Reza. At this time,
So
we
just really
will
quick,
adjourn our open session, our public
quick,
open session.
Board
We will
President.
take a 15-minute break and we will reconvene for closed session.
Board President, we had some
Yes.
clarifying questions here. Sorry, so please don't adjourn yet.
Okay.
what we're trying to find out for this specific location is if closed session goes into tomorrow, do we have to come in and open up this location and have it publicly open to open and then go into closed session? Or can Vicky participate in closed session from her home address because it doesn't have to be open to the public?
What's up?
Yeah. Can I get back to you on that, Lori, offline? I think technically we would have to open it up in open session in order to go into closed session, but I want to make sure that there's no
Okay.
exception to that.
Please let me know, because then we will travel in tomorrow and we'll open up and go into closed session from this location. So I just want to make sure that we know and that I let the facility know that we'll still continue to be using this site.
Okay. All right. I think we would go ahead and close this and enter the Teams chat
Exactly.
that the board members should have received a link to for the confidential portion of this.
Thank you. And that would be at 4 o'clock. Is that correct?
I think Dolores, did you say you wanted to take a break?
Take a 15-minute break for setup.
I'll try to open the Teams chat so that you can drop in as you're able to.
Great.
And expect that we'll get started in 15 minutes.
Sounds great. Thank you so much. I will log
All right,
out of
thank you.
WebEx stuff at this location.
Thank you, everyone.
Thank you, guys.
Thank you, everybody.